Hello and welcome, folks. Today we bring you a special treat. We have an invited faculty member who's a junior research fellow, researcher at the University in Guayaquil in Ecuador. Uh, uh, Help me welcome Dr. Hans Mautong.
Hey there. I'm really glad to be here. Thank you, Dr. Kashyap, for this wonderful opportunity to share some um, insight comments about how to choose a journal for your manuscript.
Absolutely. And those folks who don't know, Hans and myself, we both are in same class with Harvard Medical School for GCSRT program. And Hans is a phenomenal student, so very knowledgeable. We are very glad that he's here today. And the topic is, as you submit these articles, how to choose article journals where you to submit it, no matter what specialty it is. And Hans has done this, and we are very pleased that he's here today to share with us. So Hans, all is yours. Please share your screen and take it away.
Okay, thank you. So I will share my screen now. Here. There you go. Can you see them?
Yes.
Okay, so once again, I'm Hans Mautong, general physician and junior researcher from Ecuador. There's my Twitter account right there. If you want to follow, you're more than welcome. So the lecture I want to focus today is how to choose a journal for your manuscript. I know that this is a topic that tends to be underrated sometimes. But I think that I can provide you with like a 6-step clear process, like a systematic process to do this process well. Okay. So first, I want to introduce you to some terminology. I know that most of us have come across these terms in our research path. However, we don't have like the clear idea most of the time. So a lot of us has heard about H-index. H-index is basically an author or journal level metric that measures both productivity and citation impact of publications. Its exact definition is kind of bored and not very much understandable and easily digestible. So it's the maximum value of H, such that the given author or journal has published at least H papers that have each been cited at least H times. I know that it sounds like very complex and confusing, okay? So I will address it with an example. So let's suppose that we have two journals or two authors. Let's say Dr. Kashyap is the first author in the first example. So he have 5 journals. So the first thing you need to do to calculate the H-index is to order the number of publications in a descending order by the number of citations. Okay, so his first citations, his first paper have 10 citations. Okay, so the H-index would be the number of citations that exactly match the position of the paper, or is a little bit less. Okay, so let's see with the example. So if his first paper has 10 citations, the second one has 8, the third one has 5, and the fourth one has 4. This number exactly match the number of citations and the position of that particular article. So his H-index will be 4. Let's see, in other hand, myself, I have 5 papers. The first one has 25 citations. It's a really good paper. You should read it. The second one is 8 citations, the third one is 5, and the fourth one is 3. So is the number that exactly match, or it's a little bit less? So my H-index is 3, even though I have a paper with more than 25 citations, and Dr. Kashyap has his top paper is 10 citations. Yeah, even though that his H-index is higher than mine. So that's how basically it works. There are another index and indicators like Simago Journal Ranking Indicator, which is specific for Scopus or Simago Journal Ranking. So this is a measure that pretty much works the same way. It's an algorithm. It's a little bit complex, but it basically measures the impact, influence, or prestige of a particular journal. Okay. So another term that you basically came across when you're studied by statistics and stuff is quartiles. So basically quartiles is to divide a list of, participants or patients, and in these cases, the number or list of journals into 4 groups. that are divided equally into 25% each. So the first one is the quartile one, which basically means it's the top 25% of the journals. Okay, the Q2 is the next 25%, which is from 25 to 50. The third one will be 50 to 75, and the fourth one would be the last 75 to 100% group. Okay, so basically Q1 journals based on the SJR indicator, which is the measure, to measure the impact or the influence. So top journals will be at the quartile one, and the next 25% would be quartile two. So you have to keep that in mind. So the next part of the lecture will focus on why you should follow a systematic process to selecting a journal. I came with three specific benefits, which are basically the core ones, but certainly there are a lot more. The first one, it minimizes the chances of rejections. Why? Because you're basically trying to came up with a balance and analysis of what are your aims or goals on publishing a particular journal, what are the visibility that you're trying to focus on, or what are the audience you want to focus on. Okay, so if you try to match what the scope of your paper with the scope of the journal, you probably get accepted. Okay, the second one is that it will ensure you will have the best possible visibility. So if you follow this process and came up with a ranking of your own, like a personalized, a specific ranking based on your specific preference, you will find that some journals will be better suitable for you and your manuscript and your research group based on your goals and aspirations, so basically with this you will find the best possible journal that you can aim for, and of course that translates to more visibility, which often translates to more citations. Okay, and the third one is that it will save you a lot of time, primarily because, as said in point one, it will minimize the chances of rejections, but you will also be able to format your manuscript on time and don't spend a little extra days or even weeks when you're in the final part of the submission process. Okay, so the next question would be when you should aim for try to select your journal. So my advice is to do it as soon as possible, or at least while you're working on the final draft of the manuscript, which basically will be roughly 1 month prior to your submission day, or the day that you're, pointing to submit your manuscript. And I will walk you through an example of my own paper, which I had the honor to be the first author with my whole research group, amazing colleagues and mentors. Okay, so this is the title of my paper. So we basically want to assess the levels of depression, anxiety, and stress in Ecuadorian general population during social isolation because of the COVID-19 pandemic. Okay, so this is our paper, and I will walk you through the 6-step process that I usually do with my research group and myself to try to select a journal. I will disclose that this is not a bulletproof process. It will certainly have some flaws, something that we can improve, but it's pretty solid, and it can provide you a lot of handy and tools to use. Okay, so step number 1 is to search for the Simago journal ranking on your field. Okay, you can also use other journal rankings like Web of Science, for example, but I found that Simago is very user-friendly, it's free, so you can easily get this done with this tool. Okay, so you will go to Simago journal ranking website, and you will search, for example, this particular paper will go to a psychiatry journal, right? So we search for the Simago journal ranking list for psychiatry, and we found this. This is the output that the web page turns out. So we got the number of the paper, the position in the ranking, based on the Simago Journal Ranking Index. Okay, you also got the H index. You got how many they have papers they have been cited, and a whole bunch of stuff. And you will also have the country of the journal. Okay. So the next step would be to determine the quartile that you want to aim based on the quality of your work. This is a pretty important part. You have to be very, very honest with yourself. You know, as the researchers or the PIs, we have to be very objective in this part, and we have to be honest and say, you know, I know the limitations that my study have. I know the strength that my study has. I know that my sample size is big enough. I know that it's maybe not that big. So you have to be honest. This work could be a New England Journal of Medicine quality paper or not. Okay, so you have to determine what quartile you want to aim for. It's not mandatory to just aim for Q1. You can aim from Q2 or even mix it up. Some low tier Q1 and high tier Q2 will also make a good choice for you. Okay. So once that you have done this, the third step would be to basically pick 5 or more, at least 5, I would say, or more journals that you want to aim for. So when you have this list, you will go to each of these journals webpage and you will search for a whole variety of factors. Like, for example, what article types they're usually accepting. For example, some journals do not accept case reports, or some journals do not accept systematic reviews. Some journals just accept, you know, original articles or animals-based model and stuff. So you have to be very selective of this. Next is the scope. Basically, what the journal is looking for, what audience do they usually publish for, okay? Similar publication. For example, in this example, I will select BMC Psychiatry, a really Q1 good top journal in the field. Okay, so I will search for similar publications, you know, stress, depression, anxiety, COVID-19. Let's see what it pops up. So they have published a study in Germany, which is good. This means that it's an international journal that's receiving international, you know, manuscript from all over the world. Even though it's from the UK, they have papers from Germany. Also a paper from Peru, which is quite great because South America, you know, we're fellows, South Americans. Okay, so that's a green flag. Okay, so next I will search for the guidelines. So every journal has their own guidelines, which can be pretty unique to some of them. And this is basically the formatting that you have to apply to your research paper to submit your manuscript. Okay. And usually some of the journals have the time to acceptance in their webpage or the guidelines. Most of them don't, but it's some information that you should be able to gather there most of the time or sometimes. And the publication fees, if you want to publish in the open access modality, which basically charges somehow high publication fees, or you want to publish as a subscription, which basically translates to no cost in publication fees, but it's really up to you and your institution and how much support do you have. Okay, so once you have gathered all of these variables, you should always use these kind of tools, which are LEDPUB or SciRep. So the step 4 is to run the journals through LEDPUB or SciRep and check for acceptance rate and average time to peer review, or average time to acceptance, or average time to publications. You know, so you can have some kind of sense or grasp about how much time the peer review process would last, because sometimes you have time-sensitive research. You know, it's a highly innovative idea that you want to publish and get it out right away, because other groups all over the world are working some kind of similar research, and you want to be ahead of them. Okay, or maybe your institution is pushing you to publish the research right away because of, you know, different kind of factors. So this kind of give you a sense of how much time you will have to wait for acceptance or review or publications. Okay, so this is the input, the output of SciRep. It basically says how much time it would last for the first review. This one is from LetPub. LetPub also give you a sense of how difficult it is to get accepted into that particular journal. You know, it's very difficult to get accepted in the New England Journal of Medicine, but not maybe the case for a Q4 or Q3 journals, kind of different. Okay, so this kind of information also gets very handy when you're in the submission process. And step number 5 would be, based on all the data you have gathered of all these tools, you have to make your own ranking based on the suitability of that this manuscript will get accepted in this particular journal, or the time constraints, you know, how much time it will be to get published. Sometimes it will be like 3 months, 6 months, a year. Economic issues because of the open access stuff or other modalities, and the match probability that this paper will be accepted into this particular journal. And it is really important to ask yourself 2 different questions, which basically the same question but backwards. Let's see. The first one is this the right home for my paper, which basically translates to scope. The last thing you want to do is to aim for a journal that does not match the scope of your paper. For example, I want to publish this paper about, you know, psychiatry and mental health issues, but I would not want to aim for a wrong scope journal, like for example, a journal on eating disorders. Even though it's part of the branches of psychiatry, the aim is totally different. So chances are that if I submit to that particular journal, I will get rejected. So that's the thing we want to avoid, or at least minimize the probabilities of rejection. Okay. And the same question, but backwards, is my paper the right guess for this particular journal? Which basically translates to the journal's interest into your work. So for example, if you have randomized control trial, double-blind, multi-center, international trial about a cardiovascular drug, it is a very innovative and study. So chances are that you will get accepted in the New England Journal of Medicine, because the journal's interest is into that, into clinical trials, innovative trials. Okay, and if you have a whole system of international collaboration and stuff, it will be more likely you have a huge sample size. Or at times journals have particular collection of papers. For example, because of the pandemic, some of the journals have like a specific COVID-19 and mental health issue collection. So if this particular journal have this collection, they will be pretty much interested into my work about, depression, anxiety, and stress, and COVID-19. Makes sense, right? And if when you're doing your own ranking, your personalized ranking, you find two different journals that basically it's a tie, you will want to aim for the one that has more ranking, or is more highest in the ranking list, because you will want to ensure more visibility into that way. And remember, more visibility translates to more citations, which is basically the currency of academia, as you may know. Okay, so this led us to the final step, which is the 6th one. And it's to apply the guidelines to your manuscript. If you haven't already, submit your paper and hope for the best. If you get rejected, don't worry. Rejection is a common practice and situation that I'm sure that Dr. Kashyap can give faith on that. It's very common. Don't take it personal. Most of the time, reviewer two have your best interest at heart. Well, maybe not your best interest at heart, but the best interest of science. So the goal of reviewer two is to improve science, make it solid and strong and decent science to get published, to try to improve the level of research. Okay, so once again, if rejected, don't worry. Apply their suggestions, because most of the time that feedback will lead to yourself or your research group to improve the quality of your work, and try to submit to your next best option in the ranked list, into your personalized ranked list that you made based on the whole variety of factors that I previously explained. Okay, and remember, hard work always pays off. I remember I have a paper that was rejected over 6 or 8 times. And we will able to tweak it out, improve the paper, and submit it into a good journal. Okay, so hard work always pays off. And to end with our example, this is the paper that we will be able to publish in BMC Psychiatry. This is my first author paper, so it's my pride and glory. So yeah, if you put in the work, I will assure you, you will end up with the results you want. Okay, so that's that. And I will finish with a quote from Oscar Wilde, which says, "Shoot for the moon. Even if you miss, you'll land among the stars." Thank you very much for your patience and time. I hope that this will be helpful for you.
Thank you, Dr. Mautong. I think this is fantastic. This is one of the most elaborative presentations or tips I've seen how to pick up a journal, and you have made it so simple. You had the simple steps: create, go through, create your own list, and go for what is good for you based on where you are. One thing I would like to take on your intakes as well. How do you take the Bell's list, or like some of those predatory journal list in account? How you assess that you don't want to submit something which is a predatory journal, like they may not be indexed so much. So any insights on that to our viewers, that how you avoid that kind of those kind of journals?
Yeah, for sure. Basically, if you follow step 1 and go through the Simago journal ranking, most of the time all of the time, these journals are indexed into Scopus. So most of the time, Scopus would not allow predatory journals. Okay, and another extra tip that I probably didn't mention or didn't rely on was that one thing that is really, really important for me is to search if this journal is indexed into PubMed, because PubMed is the largest repository and database there is for medical science, at least. And if it's in PubMed, chances are it's not a predatory journal. But if you got these messages from sketchy or tricky directions with a email that doesn't quite fit, and they are offering, we want to praise you for your work, and we will be very pleased if you submit with us. It's kind of a scam. Predatory journals just want your money. They don't want to contribute to science. So you have to be very picky on that kind of stuff.
Absolutely. Fair point. Fair point. This was very helpful. With each interviewer, we have started asking a question. And the question for you is, share with our viewers a fun fact about you. A fun fact which you're comfortable sharing here today that people would otherwise would not guess about you, or you have done something, or you think it's a fun.
Let's see. You get me out of the blue. So basically, I used to hate statistics. It might be a surprise to you because I'm always asking questions in the biostats in the GCSRT program. Nowadays, I love statistics, but back in the day, I didn't understand nothing about it. So I got a great mentor. This great mentor walked me through the whole process. He introduced me to a whole bunch of statistic tools like chi-square, t-test, correlation, Pearson, Spearman. And nowadays it's kind of my work, my passion, and I really love statistics now.
Well, good to know. I would not be able to guess that you didn't like stats at all. I don't think so. We did, but now we have turned towards a soft side towards it and make sure that it is helping us. Dr. Mautong, this is a treat to us. We are so glad to have you here on our channel, and we are very thankful that you could come here today. Folks who are watching, please like, subscribe, and leave a comment what you like about this talk, so we can bring Dr. Mautong back. And we would like to thank Dr. Mautong on all of your behalf for doing this. This is such a treat for us and for the channel. Thank you, Dr. Mautong.
Yeah, that's great. A pleasure. Thank you.